Common nursing interventions for antibiotics. There are 4 categories of penicillin. An example of the basic penicillin is the penicillin G benzathine. An example of a broad-spectrum penicillin is the amoxicillin or amoxil. An example of the penicillinase-resistant penicillins is the dicloxacillin sodium. An example of the extended-spectrum penicillins is the piperacillin tazobactam, which is also called Zosyn. The nursing interventions for penicillins include obtain a sample for laboratory culture and antibiotic sensitivity testing of infective organism before antibiotic therapy is started, monitor for signs and symptoms of superinfection. Signs and symptoms include stomatitis or mouth ulcers, genital discharge, and anal or genital itching. Examine patient for allergic reaction to the penicillin product, especially after the first and second doses. Have epinephrine available to counteract a severe allergic reaction. Assess patient for bleeding if high doses of penicillin are being given. A decrease in platelet aggregation or clotting may result. Monitor body temperature and infected area. Monitor for neurotoxicity of penicillins. Assess for signs of improvement or worsening. And assess respiratory status and white blood cell count. For cephalosporins, there are also 4 categories. An example of the first generation cephalosporins is the cephalexin. An example of the second generation cephalosporins is the cefoxitin sodium. An example of the third generation is the cefixime. An example of 4th generation is the cefepime. The nursing interventions for cephalosporins include assess the patient for infections at the beginning of and throughout treatment, check patient history to make sure they have not had an allergic reaction to penicillins or cephalosporins in the past, obtain any specimens for culture and sensitivity before starting the course of treatment. However, the first dose can be given before the results of the culture and sensitivity are received. Monitor the patient for signs of an anaphylactic reaction, which include rash, wheezing, or pruritus, or laryngeal edema. Monitor patient for GI upset, nausea, vomiting, diarrhea, and bloody stool. Advise the patient to finish the entire course of treatment. Stopping early or not finishing the full course can lead to antibiotic resistance. Monitor patient for signs of superinfection, which includes vaginal itching or discharge, loose stool, and furry overgrowth on the tongue. May cause a positive Coombs test. Assess for signs of improvement or worsening, and assess respiratory status and white blood cell count. For the macrolides, examples include azithromycin, clarithromycin, erythromycin, or fidaxomycin. The nursing interventions for macrolides include obtain a sample from an affected area and send to the laboratory for culture and sensitivity testing before starting the antibiotic. Monitor vital signs, urine output, and laboratory values, especially liver enzymes, which include alkaline phosphatase, alanine aminotransferase, aspartate aminotransferase, and bilirubin. Monitor the patient for liver damage resulting from prolonged use and high dosage of macrolides such as azithromycin. Signs of liver dysfunction include elevated liver enzymes and jaundice. Assess for signs of improvement or worsening, and assess respiratory status and white blood cell count.